Hello, everybody. I'm Taylor Johnson, and I'm here with Dr. Dan, who has a mobile medical app, and he's going to tell us a little bit about that. Thanks so much for joining us, Dr. Dan. How are you?
Thank you for having me. I truly appreciate it.
Excellent. So tell us a bit about you. How did you get into this business?
Sure. So ideally, I'm a family medicine physician by trade. I'm from the DC, Maryland area. So I've trained in school throughout the Mid-Atlantic and a little bit on the southern, south of the US, around the Appalachia area for medical school.
Okay.
And then naturally came back for grad school. But DC is near and dear to me. So I came back and I've been working in school in here. But how I came up with the idea for the app is throughout my medical career, what I've seen is that sometimes there needs to be a tool or a resource for not only obtaining and sharing, but storing medical records for patients on a personal basis. Ideally, what doctors' offices and hospitals alike would definitely tell you is that they have their own portal. You can look into their portal for your medical records, but patients themselves aren't empowered to have their own medical application that can actually provide them a resource that they can use to store all the medical records, whether it be vaccinations, histories, imaging. And not only that, if you're a parent, you can store actual medical records for your child. Of course, if you have an elderly parent or grandparent, you could put their medical records inside your profile. And naturally, with it being double encrypted and secure, you can actually share this with a safe tool or application or social media network in which you're actually comfortable with, and share it to any individual of your choosing that you may trust. Ideally, this is oftentimes a new doctor or another family member that needs access to your medical records.
Well, that sounds great. So, you mentioned that it's double encrypted. So that's amazing. Could you explain that a little for somebody who might not know what that means?
Oh, sure. And naturally, because I'm a family medicine physician by trade, ideally, I wanted to make sure I go about obtaining the right knowledge and the right support to ensure before I make a medical application such as this, I have the right knowledge and know-how. And more importantly, when it comes to something like this, what people are going to care most about is their privacy. So I need to make sure that I go about ensuring that I have a network and a maintenance server that's going to be very secure, of which not only directed through my actual app developing company that actually helped me develop the app, but also through Amazon Web Services, all of which are designed to do this thing called HIPAA compliance that provides for very secure and private medical records. So people can always rest assured and rest easy that all the medical records are right there, secure, handheld, at the ready on their phones, but naturally also in a very secure network. And that's what that means.
Well, that's terrific. And I can just think about like my medical record. I've moved, I don't know how many times in my life, and had to start over doctors. And even just living here in DC for almost 30 years, my medical insurance plan changed multiple times and I had to start over with doctors. And I don't have those records. I don't know where they are. It's like, so I have big holes in my history. Of course, we didn't have things such as apps in those days. But for somebody moving forward, I can just imagine this is a tremendous boon because you won't lose all that stuff.
Absolutely. And you just have to think, just because when it comes to, I mean, granted, I've already gone through the college and the grad school, but even with medical school, they always ask, I want your titles, your proof of immunizations, your proof of this, your proof of that. And then now, unfortunately, with the pandemic being hit, you're going to need proof of COVID vaccination. There's just so many different times in which, and not just for schooling, but also for employment, all of these different entities are asking for different medical records. So I figured, why not have something there at the ready for you and your family members and future doctors?
Excellent. So is it up and running now at this time?
Oh, yes, it's live. Oh, yeah, it's live, good to go on.
And how many
now
subscribers do you have so far?
Ideally, it's still new, so naturally just in the upper hundreds. So it's like only a little under 1,000, so not a lot yet. So we're still working our way up because we just got released.
Just starting, yep. Yeah. So is there a subscription fee, or how does
there's
that
a free mobile? Yeah, this is a free device, and it's designed to be free, just so you can use it, download it, and access it at your leisure, just so it can be utilized just for your own whether it be for emergent basis or just for on a day-to-day wanting to know your medical history or refer back to that last specialist you saw, that last doctor you saw, all of those. Yes, but it's a free
Excellent.
app. Yes.
So I guess this is a basic question, but I don't have any of my medical records. And even like I just went to the doctor this morning, I don't have any record from that visit. So how does that work? Is there some interface between the app and the doctor's office that the doctor agrees to or something like that?
So that would be good, and that could be something that we could look into for the future. But ideally, just to ensure that the empowerment's really left in the hands of the patient, what we like to happen is that most patients, and I'm not sure they realize, even though they can access to some portal or some third-party medium online, they can log in to look at their records. But patients can actually go to their doctor's offices to get their previous medical records. And so when you do that, that's when you can actually upload it onto the application by whether you scan it, take a screenshot of it. As long as it becomes a tangible file, then you could place it inside the application so it never gets lost. But the initial first step will be, of course, having the medical records. And because this is largely designed just for patient empowerment, you'd probably have to go through the initial first step of just getting those records from your doctor first. So that would be the best initial first step.
Right. Okay. And then, so at this point, then maybe once a year or something, you'd get an updated file and add it in.
Yeah, or even sooner, right? Exactly. And as some of my patients, because I do have patients in upper 90s and 100, and so by that time, well, I mean, you're definitely referring back to it a little more than once a year. But ideally, yes. Other than that, other than of course my patients that required a little bit more care, yes, you definitely end up utilizing no less than once a year, if not more.
Okay, excellent. So what do the folks who are on the app now have to say about it? Do you have positive feedback?
So what the feedback I've gotten is tremendous, because also what I've also done is I've made the app bilingual, so it's fully in English and in Spanish, so it reaches out both to not only my English speakers but my Spanish speakers, just because throughout my training and of course throughout the experience I've had with the patients that I serve, what I've seen is that I have a pretty high, of course, English speaking population being here in the DMV and of course the US, but also I have a growing Spanish speaking population. So because of which I wanted them to also have the opportunity to have a resource that can be utilized for them. So because of which that utility in and of itself has made a tremendous impact, and I've gotten very good feedback just for starters. And then number two, what they told me just that it's user friendly, just because the last thing I wanted was some just really just complex, robust, not easy to navigate app, just because I can tell you right now, I don't like those apps and I prefer not to make one for any of my patients. So what I've been told is that it's easy to navigate and it's easy to flow through. And it's easy to find the information that you need, and also that it's easy to upload. So because of all those things, I've gotten pretty good feedback thus far. And then naturally, I, of course, accept any and all feedback, reason being just because it's an ongoing process of development. I have to update and adjust based on what our patients feel we might need or what might be better able to serve them. So naturally, even though we have a good start, we're nowhere near finished. We're going to keep going and updating and adjusting on an annual basis just to make sure we continue to adapt to what the consumer needs, or rather my patients in these cases.
Right, sure, of course. Well, that's, I guess, part of today's technological world, right?
Oh, yeah.
Always updating.
Yeah, because right now we have Microsoft Teams, LinkedIn, WhatsApp, but next 2 years we'll have a whole nother thing. So I mean, I just always have to be on top of whatever is going to be the next big platform that's going to be the best media tool for my patients or any of my future consumers to use.
Right. And so, of course, you said you're in the DMV area.
I am.
But this being an app, it could actually be used by anybody in the country, right?
Oh, without question. I mean, actually, right now, as much as it's largely based in, I've let it freely be downloadable all throughout North America. So that includes, the U.S., Canada, and Mexico. However, I do plan on expanding that. The more we fine tune the process and feel as though we can provide a service that can be utilized globally, is going to be definitely expanded. Oh, but without question, it's like all throughout North America, without question.
Okay, well, that's cool. So where in the DMV are you based?
So I am actually now based. I've lived in DC. I've lived in DC, and I've also lived in Maryland and Montgomery County largely. But now I'm in Lower Ward 5 in Northeast Washington DC, and I work throughout not only the wards 5, 6, and 7, but on occasion I do tend to branch out and sometimes do a little bit of work in Maryland. Largely more volunteer work than anything else, but because of which I still service the two areas.
Okay, So do you have offices in those places, or you go to clinics, or what?
I have
How do you
clinics,
go to these different
absolutely,
places?
without question. So I work at a Providence Hospital. That's going to be a hospital-based group. And then I also work for a community-based health center called Unity Healthcare. So I work at both of those entities, and those are my largely main-based entities as well.
I see. So if somebody is so impressed with your app and they want to see you in person, that's how they would do it, right?
Without question. No, even, yeah, that's, I mean, and if I've honestly, as much as I thought about this as really being a tool for them to use, they can easily do that as well. I mean, no offense or buts about it. But of course, if you download it in California, you can't necessarily make an appointment with me the next day because, well, I'm not within your locale. But yeah, but that's a very good point. That's not even considered. Yes.
Excellent. And so, what are some of your favorite places in those areas to hang out or dine or
whatever? Oh, okay. Oh, so we could run the full gamut. So we're gonna go to the so I mean, but let's say so in my surroundings, so like Hyattsville, Mount Rainier, that surrounding area. So my favorite places to go to. I'd say number one, I'd have to go to Franklin's. I mean, I just love Franklin's just because it's local, it's near, it's homegrown, it's nice, has a good atmosphere. So I'd say that's one place I definitely
They're
love
so
to
friendly,
go to.
aren't they?
Oh my gosh. And they've been around for years. And even just a backstory, starting off of as a sandwich stop and then taking off to just be this really elaborate restaurant that just serves the community. I think that's wonderful. But then of course in the DC area, I mean, there's going to be a numerous amount of places that I'd say that I'd love to go to, but of which I'd say that I am a lover of any and all types of foods. But if I were to definitely choose anything, I'd say that me and my wife definitely love to attend restaurants all throughout the DMV, including the Wharf and including the National Harbor and Georgetown as well. So if I were to say, for instance,
you get around a bit then.
I try to. Without question, we definitely like to do things a little bit different, just because we want to like to mix things up, and of course, we like to embrace the entire area because naturally, because we have so much to offer, it's always going to be a wonderful thing when we have so.
There's so much wonderful food in this area, isn't there?
Oh yeah, without question.
Have you tried some of the new restaurants in Mount Rainier?
Let's see. Other than let's see how many. Well, now near on the border, so heading towards down Rhode Island Avenue towards Riverdale, we have tried a couple of restaurants there. But other than that, I don't think we've tried any of the newer restaurants as of yet.
Well, you should. You should come out and try Pennyroyal Station or Doda's Kitchen.
Okay.
They're both really good, and they're at the Circle or Mount Rainier Circle.
Okay. Yeah, sounds good. Without question. Yeah, and what type of food do they serve? Excuse me.
Well, Doda's Kitchen is kind of soul food.
Okay, wonderful.
And Pennyroyal Station is, American Bistro, maybe I might say. I mean, it's really good food. I'm not sure how I would categorize it.
Of course, no, I understand. Definitely understand. Okay.
And then, of course, there's the Pizzeria Paradiso in Hyattsville too.
Oh yeah, that's actually a good one. Yes, that's actually quite a good one.
And Riverdale has a new tapas restaurant and a new Vietnamese restaurant that are also.
And actually, my gym is actually near there as well. So speaking of which, that might actually not be too bad for me to attend. So
yeah, try it out. The Vietnamese is banana something cafe.
Yeah, of course. I'm sure I'll be able to find it.
Right across the street.
Yeah, well, I'm excited now. I mean, I always love a post-workout area to go to, other than, of course, my natural Whole Foods where I pick up things to buy and cook with my wife. We love to mix it up and sometimes eat directly afterwards. So if we know there's a wonderful nearby restaurant to go to, we love to do so after a good workout. Yeah,
awesome. All right, well, so maybe we'll bump into each other in the area if we're both.
I think that's very likely. Oh yeah.
Thank you, Dr. Dan, so much for your time. I'm going to put in the description below for anybody watching the best way to reach you.
Of course.
The name of the app again is Mobile Medical App, right?
Well, the name is History Made Easy. That's the name.
Oh, right.
So History Made Easy is the actual name of it, but it's a medical mobile app, and like ideally it's designed to be a one-stop shop for all of your patient, or rather your personal medical records. And this will be for you, your future children, as well as for any family members.
All right. And medhistorymadeeasy@gmail.com is the best
Please.
best email for you as well.
And that would work not only just to reaching us, but also if you have any questions, any feedback about the app, we'd love to have it. And that's the best resource in order to do so.
Excellent. Okay. Again, thanks again for your time. And folks, my name is Taylor Johnson. I'm a real estate agent with Keller Wiliams Capital Properties. I'm based in Hyattsville, Mount Rainier, and Woodridge. Those are my areas of specialty. So if I can help you in any way, answer questions or be a resource for you, please reach out to me. My contact information will be below as well. Thanks very much. Let's stop the recording.